There are many negative names for this drug that can make it seem like it cannot be used for medicinal purposes. These are a few: Mary Jane, weed, dank, loud, grass, herb, the chronic, astroturf, cannabis, and hemp. But all of these negative names are really just marijuana. In 2012, there was an astounding 749,825 marijuana-related arrests in the United States. Have you ever stopped and wondered if these individuals who were arrested had anxiety and were self-medicating a bigger issue? Some states allow medical marijuana, but the majority does not. Marijuana is not just what people call the gateway drug. It is also called medicine. If every state in the United States of America allowed medical marijuana, imagine how much stress would be released. There would be fewer arrests and maybe some less symptoms that cause everyday people pain. Medical marijuana can help people with illnesses such as Crohn's disease, mood disorders, glaucoma, migraines, and cancer, just to name a few. First, medical marijuana can help people with Crohn's disease, which is an inflammation involving any location of the gastrointestinal tract. One patient with this horrible disease said, "The medical use of marijuana has saved my colon and my quality of life." Also, it is shown that medical marijuana helps to decrease inflammation in the gastrointestinal tract. Secondly, medical marijuana can help people with mood disorders or migraines. Medical marijuana has helped many people battling depression or anxiety or any other psychological disorder. One person who suffers from depression states, "The power of cannabis to fight depression is perhaps its most important property." Also, people who have studied the effects of medical marijuana and migraines have stated, "The vascular changes cannabis causes in covering the brain or the migraines usually makes the migraines disappear." And lastly, medical marijuana can help people who suffer from glaucoma or any other types of cancer. People who have glaucoma have stated that after using medical marijuana for their medicine, they could stop their other oral medications because marijuana took the place of everything else that they were originally taking. So instead of taking many medications, after marijuana, that was all that they needed. Also, people who have cancer have a common symptom of nausea, which is an upset stomach, which is bad. Medical marijuana is a drug that can actually suppress that nausea and make people who are going through chemotherapy more comfortable while they're fighting for their lives. So in conclusion, medical marijuana can help people, millions of people, with their struggle of Crohn's disease, mood disorders, glaucoma, migraines, and cancer. Also think about if every state in the United States of America allowed medical marijuana. Imagine the fewer arrests and fewer symptoms that cause people pain every day. So next time you hear someone talking about marijuana, don't assume that they're potheads or stoners. Think maybe they are using medical marijuana to help them in the long run. Thank you. The three sources that I used for this speech. My first was medical marijuana for treatment of chronic pain and Other Medical and Psychiatric Problems, a clinical review, and that was from the Journal of American Medical Association. My second source was Colorado's rollout of legal medical marijuana is succeeding, a report on the state's implementation of legalization. And that was from the Case Western Resume Law Review. And my third and final source was medical marijuana for digestion disorders. High time to prescribe. And that was from the Medical Journal of Gastroenterology. Thank you.